All right, you trust your doctors and nurses to provide medical care with your best interests in mind, and of course, most of them do that. But there are cases of providers diverting drugs or prescribing drugs that end up being misused.
So many worst fears out there. Our investigative team went through dozens of cases here in Arizona since 2018. Investigative reporter Amy Cutler joining us now. What trends did you find here?
Well, it is just alarming, all of these records that we went to. Our findings come from disciplinary records, some of which are hard for you at home to find, but some troubling trends that could put you at risk, from providers high on the job to doctors prescribing hundreds of opioids, and perhaps most surprising, even after this conduct was identified, most of these providers are still involved in your medical care.
You're the secretary.
In my practice, my provider.
That's Dr. Steve Fanto. For 24 years, he was a licensed doctor specializing in pain management.
It's a nurse practitioner that's back there?
Yep.
Okay. And you don't help her with any of the services? No.
Informed.
Okay.
I'm very misinformed. Clearly, I'm secretary sitting right here.
Fanto can't practice medicine because his license is suspended and has been since 2017. Yet we found more than half a dozen online reviews, some as recent as late last year. Most praise Dr. Fanto's work.
And so what's the setup that you have here?
Yes, they said I'm not answering.
Some families say that you overprescribed drugs and it led to the death of their loved one, so we're following up. What about the settlement with the Attorney General's office?
It's all public information.
In 2017, the state attorney general's office filed a lawsuit against Incest Therapeutics and 3 doctors. Fanto is one of them. They claim these providers accepted money from Incest in the form of sham speaker fees. In exchange, they wrote lots of prescriptions for Subsys, a highly addictive fentanyl spray that at the time was only approved for cancer patients. But the lawsuit alleges Fanto ignored that, writing his prescriptions accounted for 75% of all Subsys sales in Arizona. As part of a settlement, Fanto agreed to pay the state more than $400,000.
Why would you agree to the settlement if you did nothing wrong?
But I know you're just trying to do it.
And Fanto isn't alone. We reviewed 36 cases of doctors and nurses diverting drugs in Arizona, some with devastating consequences. In one case, a doctor showed up to work drunk and misdiagnosed a child. In 2 cases, their diversions fueled pill mills. And in another, they were prescribing so many drugs, Walmart and Sam's Club pharmacies refused to work with them.
Is that surprising at all to you?
It's not surprising.
Lisa McGiffert is with the Patient Safety Action Network. She's worried this is a chronic problem in the medical field.
There's way too much secrecy about these professionals. We put our lives in their hands.
The Drug Enforcement Administration, or DEA, investigates some of these cases. They can determine if criminal charges are warranted. Of the cases we analyzed, only 5 of the 36 resulted in charges. In recent years, the state has added additional layers of oversight. The Board of Pharmacy runs the Prescription Monitoring Program, which reports providers suspected of inappropriately prescribing to the Medical Board and the State Board of Nursing.
Addiction is still on the rise.
Can Gandhi is the executive director for the Pharmacy Board and a pharmacist himself.
You got healthcare professionals that know about addiction, the potential of these medications, how dangerous they can be, and how closely they need to be monitored.
He stressed they only flag a very small percentage of providers.
We're not here to dictate how an individual practices.
But the decision to discipline doctors or revoke their license is made by the state medical board, where 8 of the 12 members are doctors. They declined an interview.
Boards are very reluctant to take actions that will restrict members' licenses.
When you look up Dr. Fanto's license on the Arizona Medical Board's website, there's no mention of that settlement. No mention of the 3 medical malpractice lawsuits we found. In August, he appeared before the board to get his license back.
I have completely been humbled and forced to acknowledge the mistakes I have made.
The board responded with a decree of censure or a formal public reprimand, citing 4 of his patients, writing he deviated from the standard of care, starting them on high doses of opioids without proper documentation.
Would you ever apply to get your license back?
I'm waiting to hear back.
The Arizona Medical Board confirms Dr. Fanto has an application pending to get his license back, but declined to provide any additional information.
So what about the nurse practitioner at his office?
Yeah, good question. We wanted to find out more about her. We looked up her license, and what we found is she has a valid license, has no disciplinary action, but as far as we could find, she also has no experience working in the pain management field. But we checked with the nursing board, and that too is legal here in Arizona.
Gosh, all those years of medical school and training you go through, you kind of left
Right.
scratching your head about this kind of stuff, Amy.
Wow.
Thanks.